Over the past 2 years and change, the core of what life is was shaken almost irrevocably when COVID-19 made itself known. The effects it had on businesses still ricochet to this day, the remnants of which are the continuous profit losses for some businesses, leading to mass job losses in many parts of the world, rising inflation which will steadily result in the cost of living going up, amongst many other consequences. Some sort of stability has been attained, however, since the arrival of vaccines, which have seen a decrease in the number of hospitalizations due to moderate to severe disease from being infected with the virus. Even so, more information keeps coming out as the virus evolves, with the understanding of scientists studying its behavior and how it affects different people. At the outset of the pandemic, the understanding was that people with chronic conditions were most likely to be more burdened by the disease. Then, when the Delta variant came, the goalpost shifted as it seemed to affect almost everyone severely. Some time has since passed, so what do we now understand about COVID-19 as relating to chronic diseases? Well, here's what the scientific and medical communities have learned thus far, as shared by pharmacologist and consultant cardiologist Dr. Kiran Pakat. Today we want to talk about COVID and chronic diseases. Let us start first by how it affects those with obesity.
I think what we've learned in the last 2 years is there are certain members of our population, locally as well as globally, that have occupied our hospitals and intensive care units and have not, in some cases, come out as well as those who don't have these particular conditions. And I think top of the list is obesity. People who are overweight, in other words, a body mass index more than 25, or a waist circumference more than 90 centimeters if you're a man, less than 80 centimeters if you're a woman. I can see everybody tucking their tummies in, are those at a high risk. We know that obesity, amongst many other chronic diseases, produces inflammation in the body. We know that certain inflammation markers, we call them cytokines, which are biological mediators of inflammation, are high in obesity. We know that obesity of a particular type, particularly those, we've talked about this many moons ago, where the obesity around the tummy is the one that is the most toxic. And more recent interesting data shows that the virus actually may secrete itself, in other words, hide itself in the fat cells of the abdomen, only to release again and reinfect or be exposed and cause this problem. We know that therefore when you are attacked by COVID, which causes inflammation, all you're doing is heightening a pre-existing inflammation. And when the body is inflamed, the lungs are inflamed, the brain is inflamed, the heart is inflamed. These are the complications we see in the intensive care unit, we see in the high dependency units, where they develop heart failure, they get a stroke, they may have a heart attack, and they get this terrible lung infection, often requiring ventilation because the oxygen levels are dropping. So it's with that sort of soup of pre-existing conditions, and obesity is the top one. We are concerned for those out there that live with this chronic, we can call it a disease if you like, it's a lifestyle disease. And you know, the statistics coming out of Gauteng is that 68% of black women in Johannesburg are overweight, and we don't live very far from them. So, you know, we need to be aware, and we just need to look outside the door and we see people that are not exercising, people that are eating all the processed foods we've talked about. So I think in terms of obesity, it's important to understand it is one of the preventive aspects of putting yourself at a lower risk of COVID, other than the ones we've talked about before, where we said obesity was a risk for heart disease and cancer. Now, COVID is just another part of the package to say, you know, you want to prevent getting serious COVID, make sure you attend to the issue of your exercise and your nutrition and your diet and a weight loss program if you're overweight.
Let us talk about another one of the ingredients within this chronic disease soup, as you've just referred, and that is heart disease.
I think, you know, these are all consequences of poor lifestyle. You know, we've talked about heart disease on a number of other occasions, and now it's come up yet again as an additional poisoned arrow that if you already have blood pressure, if you've had a heart attack, if you've had a problem with your circulation, whether it's a clot in the leg or you've had an issue in the brain, these are all part of heart disease, which is part of the blood circulation. And we know from the last 2 years of COVID infections that a substantial portion of our patients at high intensive care unit institutions, when they did scans of the chest, we found clots in the lungs because COVID causes an increase in the clotting. We know when you have a heart attack, what a heart attack is a clot in the heart. So COVID plus clotting and heart disease and clotting are simply, there's a fateful alliance between the two. And therefore we know many patients who've had COVID, we've had to put them on aspirin afterwards because we measure the clotting levels and they're extremely high. So COVID is what we call thrombogenic. It produces a stickiness in the circulation. And if your circulation is already impaired by a buildup of sugar and a buildup of cholesterol within the arteries, you're just adding literally a huge amount of petrol to the fire. So in terms of heart disease, it's really important for people out there to understand if you do have heart disease, and we talk about blood pressure and high cholesterol and a heart attack and a stroke, these are all cardiac or cardiovascular risk factors. You need to, one, make sure you're vaccinated. The third is make sure you're boosted because you're high risk. So you need to make sure that you take all the preventive measures, particularly I'm speaking to those that are amongst those that don't want to take the vaccine and do have these pre-existing conditions. So this is really important in terms of risk stratification. And this is what we're trying to teach our junior doctors, to say risk stratify the patient. If they come to you and say, I don't want to take the vaccine, present to them the risk that they're putting themselves under, not only for their chronic disease getting worse and spinning out of control and landing up in kidney failure or heart failure or a bad stroke, or that your chronic disease is going to fly out of control. For example, if you're diabetic, we know that one of the treatments for COVID during the hospital admission is to give you steroids. Steroids are to dampen down the fire that's existing in your system when you have COVID. But the steroids have a side effect of raising your sugar. So if you're diabetic and you already have a problem with sugar, we know our diabetics that were admitted in the hospital in whom we gave steroids, we had to really attend to the sugar because the sugar was all over the place, because you're now adding fuel to the diabetic situation in order to control the COVID situation. So it's a situation that we find ourselves painted into a corner and cuffed to say we need to deal with the acute issue of COVID, but we know the chronic disease is going to get worse. And so this is where we landed up in hot soup in the last 2 years.
So what of lung disease?
We're talking about the alpha and the delta and the gamma variants that occurred preceding Omicron, which seems to be more upper respiratory, is that if you had those infections, they really went into the lungs and caused people to cough. And as everybody knows from the media, the oxygen levels began to drop. Now, if you already you've worked in a mine, or you've had tuberculosis, or you are a chronic asthmatic, or you have allergies of some particular sort that get into your chest, you are one who's already inflamed in the chest because of pre-existing problems, scarring on the lungs because of previous pneumonia or TB, HIV-related pneumonia, you've had cancer and you've had radiotherapy to the chest. So these are all conditions in which the lungs are already presenting themselves as unhealthy or not in peak conditions. So you then add, this extra coal to the fire, it literally lights up. And so those who are asthmatic, we increase their inhalers. Those who have TB, we make sure that they are boosted and that they are taking preventive measures and that they do isolate at the sign of an early infection. So we've now begun to risk calculate to say you are high risk. And we do see children, younger age, who are very badly asthmatic or who are immunocompromised in some way. And those are the ones we particularly focused on in terms of vaccination as well as boosting in that particular group of population. So that's important as well in terms of lung disease.
You've alluded to diabetes as, in connection with being infected with COVID, but I want you now to go further into giving more insights into that. What do diabetic patients need to understand, about how COVID affects them and what they need to do to protect themselves, and in the cases that they've been infected, how do they take care of themselves? It's
really critical to understand that the majority of diabetes that we see in this country is representative of what is seen globally. The WHO, the World Health Organization estimates that there are approximately 500 million diabetics on the planet. And that's a huge amount, 500 million people worldwide. And the principal reason is the rising incidence of obesity. When you're diabetic, you basically, the type 2 diabetic or adult onset, in fact, we don't call it adult onset anymore because we're seeing it in children who are overweight. You are depleting the insulin in your body to drop the sugar, because insulin is the chemical the body manufactures to drop the sugar that you're eating. Now, if you're continually eating processed foods that, cause a strain on the sugar system the sugar balance in your system, you deplete the insulin reserves in your body. You cause increasing insulin resistance. In other words, your body will produce the insulin, but you're eating so much sugar that there's not enough to mop up the sugar that you're taking. And I'm not talking about the sugar in your cup of tea. I'm talking about the bread and the palachi and the rice and the pasta and the fresh chips, the fruit juices, the fizzy drinks. Using processed oils, using excessive starchy processed foods are the things that are causing our obesity, which then have a double-on effect on diabetes. So if you're diabetic, whether you're taking tablets or whether you are unfortunately already having to resort to insulin-based regimens, you're already presenting a risk, because the sugar, which is one of the most toxic compounds we consume, causes the body to become inflamed. And again, it's inflammation that is pre-existing is a catalyst for COVID. So if you get COVID and you are diabetic, it's literally food for fodder for this virus to replicate and duplicate and get into your system, because that inflammation causes a reduction in the immunity, and as a result we see our diabetics are much more at risk. So the take-home message is, if you are diabetic, you need to make sure that your lifestyle is tight in terms of control, making sure your weight is under control, making sure you're eating the right foods, making sure you take your medicines for diabetes, making sure that you maintain the appropriate body mass index, making sure that you are double vaccinated or boosted, and then that you take precautions if you're going out into crowded places, because you are one of those who is high risk.
This program was brought to you in association with First National Bank of Botswana.
FNB, how can we help you?